Hello. Today, we will be discussing a relatively common cardiovascular disease called a stroke. As a side note, all the links to the sources I use will be placed at the end of this video. In this video, we will be defining what a stroke is, explaining the biological causes and risk factors of a stroke, discussing common symptoms and what causes them, and finally, explaining how strokes are often treated and the common prognoses. To begin, let's try and understand what a stroke actually is. As defined by the Mayo Clinic Health System, a stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells and tissue begin to die. So in other words, a stroke is simply what occurs when our brain does not receive enough oxygen, which can be caused by a few different factors, all of which we will discuss in a moment. It is important to know that there are different types of strokes. So here, I have an image of a brain that is showing the major arteries. To give you an orientation, we are viewing the brain from the underside. Down here is the brainstem. This will be useful as I describe the following. A stroke may be caused by a blocked artery called an ischemic stroke. So for example, if a blockage were to occur here, blood would not be able to reach this part of the brain right about here. A stroke may be caused by the leaking or bursting of a blood vessel called a hemorrhagic stroke. So for example, if a blood vessel was leaking or ruptured here, it would bleed into the brain in this region right about here. And a stroke may also be caused by only a temporary disruption of blood flow to the brain that rarely causes permanent damage. This is called a transient ischemic attack, or TIA. Let's talk about the first type of stroke, ischemic, to begin. About 80% of strokes are ischemic strokes. An ischemic stroke is a result of narrowed or blocked arteries, which in turn causes a significant reduction of blood flow to the brain, also known as ischemia. A blockage capable of causing an ischemic stroke could be when a clot forms in an artery that supplies blood to your brain as a result of a buildup of fatty acids or plaque. This is also known as a thrombotic stroke. Other blockages can occur when debris forms away from your brain and is moved through the bloodstream to become stuck in smaller brain arteries. The debris commonly forms in the heart. It is also known as an embolic stroke. So here on this image on the left, we have an artery that is being restricted by fatty acids or plaque. In the image on the right, you can imagine for a moment if a piece of plaque were to break off from the heart, travel up major arteries, get stuck in small arteries near the brain, forming a clot. Alright, now that you have a general idea of what an ischemic stroke is, let's move on and talk about what a hemorrhagic stroke is. As said before, a hemorrhagic stroke occurs when a blood vessel leaks or ruptures. This can happen as a result of uncontrolled high blood pressure, known as hypertension, overtreatment with anticoagulants or blood thinners, and weak spots in your blood vessel walls, known as aneurysms. This is shown in the picture here. A blood vessel ruptures in the brain, bleeding into the surrounding area and causing damage to the tissues and cells. The final type of stroke that we have yet to talk about is transient ischemic attack, or TIA. Like a normal ischemic attack, TIA occurs as a result of a blockage in a blood vessel, interrupting the flow of blood to the brain. However, TIA lasts for only minutes and typically does not cause any permanent damage. TIA can be an indicator for your risk of having a full-blown stroke at a later date. To very generally summarize what we just learned, the major takeaway point about these types of strokes is this. Strokes occur when the blood flow to the brain is interrupted, either by a clot, leak, or rupture. Now that we know what strokes are and the anatomical reasons behind them, let's discuss the most common symptoms of a stroke and the reasons they happen. The most common symptoms include trouble with speaking and understanding. You may not understand speech and you may slur your words. Paralysis or numbness of the face, arm, or leg. This often only occurs on one side of your body. trouble seeing in one or both eyes. This could include double or blurred vision. Headache. This is often coupled with dizziness, vomiting, and altered consciousness. And trouble with walking, which is generally a result of impaired coordination. So let's consider for a second, why do these symptoms occur? Anatomically, what is causing someone else's body, who is having a stroke, to act in this peculiar way? I'm hoping you understand that our brains are the control centers of our body. Speech, movement, sight, coordination, thought, and memory are all controlled by different sections of our brain. So during a stroke, when cells and tissues are essentially being starved of essential nutrients, our ability to do some of the functioning tasks we are used to are severely impaired. If strokes remain untreated, the damage can be permanent and quite extensive, and potentially fatal. This leads into the last item on our list of things to discuss: treatment and prognosis. Treatment for strokes range from medications to minimally invasive or intensive surgery. The most esteemed treatment is the administration of tissue plasminogen activator, or TPA, also called alteplase. The drug dissolves the blood clot and can work relatively successfully within 4.5 hours of when a stroke first begins. Other procedures include stents and surgical removal of clots. On this image on the right, I have an example of what an operation involving a stent may look like. Many factors can make the prognosis for stroke victims vary. Age, health, medical history, type of stroke, and severity of stroke all play a part in the longevity of recovery. However, for most stroke patients, some sort of rehabilitative recovery is required. For some people, it may be days, others weeks, and for some, months. To summarize, in this video we learned about what strokes are, the different types of strokes, the symptoms and what causes them, and finally a broad overview of the prognosis. I hope you enjoyed this video.